South Africans living with inflammatory bowel disease are encouraged to ask deeper questions because healing isn't just about feeling better, it is also about repairing the gut from the inside out. Now, IBD is a chronic illness that includes Crohn's disease and ulcerative colitis, both of which cause long-term inflammation and damage to the digestive tract. And symptoms can include abdominal pain, fatigue, diarrhea, rectal bleeding, as well as weight loss. And in several cases, people report needing the bathroom more than 20 times a day. And it's a disease that often is invisible to others, yet relentlessly disruptive to the person living with it. So to help us unpack this, we joined here in studio by Medical Affairs Director at AbbVie South Africa and Sub-Saharan Africa, Dr. Nombini Habangana. Thanks so much for coming through, Doctor.
Thank you so much for having me. It's a pleasure to be here.
And what an interesting discussion, inflammatory bowel disease. So what exactly is this?
So, Sakina, I think you went into some of it initially, right? So, inflammatory bowel disease is a chronic, relapsing and remitting disease where there is chronic inflammation of the gut, right? And IBD is really an umbrella term for two very distinct yet overlapping diseases, as you mentioned, Crohn's disease and ulcerative colitis. And the main distinction between the two is that Crohn's disease tends to affect the whole GIT, so from the mouth all the way to the anus, whereas ulcerative colitis affects mostly the colon and the rectum. And as you said, you know, chronic persistent diarrhea that these patients suffer with, and yes, up to 20 times a day. I mean, you can imagine how disruptive that can be to your life. Very severe abdominal pains, rectal bleeding is a key feature. And yeah, that chronic persistent diarrhea is probably the worst part, because as you can imagine, these patients kind of have to plan their lives around using the bathroom, right? And this can lead to a feeling of social isolation where you don't want to be out there with your friends and your family, because when you get to a restaurant, you look around and try and see, okay, where's the nearest toilet? I kind of need to position myself closest to that. Yeah, and that's kind of, you know, the main concern about it, that patients can go into anxiety and depression, and we need to deal with those symptoms as well as the physical symptoms.
It really sounds so debilitating. So, you know, what causes IBD and how is it diagnosed?
So, despite, you know, extensive research on the topic, it's still not 100% clear what causes it, right? But we believe that it's a play of multiple factors. So, firstly, genetic disposition. So, if you have a family history of IBD, your risk would be higher. Secondly, environmental factors play a role. So, smoking, your diet, antibiotics, you know, things like that. And then as well as your gut microbiome, so the bacteria in your gut. And then lastly, your immune response. So your immune response is not adequate. So the immune system kind of reacts abnormally to the bacteria in your gut. And all of these kind of come together to cause IBD. And the second part of your question was, how do we diagnose it?
Yes.
So when a patient has those multiple symptoms, right, you kind of start worrying, like what's going on. You'd go to your GP. Your GP might initially think, okay, this might be a viral infection, give you some treatment. You come back, but there's this persistent diarrhea, there's this unintended weight loss. Then they might consider referring you to a gastroenterologist, who will then do an endoscopy. So an endoscopy is when they put a camera either down your mouth, so that's a gastroscopy, or from the back through your anus, that's a colonoscopy, where they can actually visualize the inflammation. And in certain instances, they will take a biopsy to confirm the diagnosis in the lab.
So, Dr. Habangana, you know, when you're listening to all of that, you know, you start to wonder, because you did mention it could be genetic or hereditary. So is there anything someone can do once they have been diagnosed to sort of ease, the symptoms and, of course, the effects of IBD?
So in IBD, we have what we call flare-ups, right? And this is instances where the symptoms just become more severe and the duration and the severity cannot be predicted, right? These flare-ups can happen at any time. So to try and avoid that, it's important initially for the patient and the HCP or the healthcare practitioner to really come up with a management plan together, right? So shared decision-making between the HCP and the patient. And as a consequence of that, it's really important that the patient sticks to those that management plan, right? Even when they feel better, even when they're asymptomatic, they should stick to that management plan. Make sure that they take their prescribed medication as per the doctor. Try to avoid triggers. So stress is a big trigger, smoking in some instances, getting sick. So if you need to vaccinate against certain infections, do that. And just be aware that certain things do trigger you and try to avoid those.
And when people perhaps, start feeling unwell and try to self-medicate or ask Dr. Google to help medicate, and maybe start taking some anti-inflammatory drugs.
Yes.
Is that advisable?
It is not. So there's many classes of anti-inflammatory drugs, right? So for ulcerative colitis, we do use anti-inflammatories, but this is a specific kind called aminosalicylates. What patients tend to when they self-prescribe, it's normally non-steroidal anti-inflammatory drugs, your Brufens, I won't go into the brand names, but those are the ones that are really quite destructive to the gut. So they can actually exacerbate the symptoms, increase the inflammation. So in instances where you might have other manifestations or other diseases where you do require NSAIDs, these need to be prescribed by your HCP. Don't take anything that will actually make the gut inflammation even worse.
And just finally, again, just those symptoms to look out for where you may start to suspect that something may be wrong here, and it's not just you being lactose intolerant or something.
100%. So that chronic persistent diarrhea, the rectal bleeding especially, that severe abdominal pains, that should really get you worried. But we recently did a podcast and a video with an HCP and a patient living with IBD, and it's not just a gut feeling. So it's available on all platforms, Spotify, Apple, and patients and just the general public can go on and listen to a patient's perspective. I can only give the scientific side, but hearing what a patient really goes through, I think that's really important. And sometimes, as much as I give you these list of symptoms, certain patients may present with maybe just a severe abdominal pain and then the other symptoms come later. So it's just good to have that, especially for GPs, to have that high index of suspicion that this might be IBD and then refer appropriately.
Well, thank you so much. That was Medical Affairs Director at AbbVie South Africa and Sub-Saharan Africa, Dr. Nombini Habangana, speaking to us about inflammatory bowel disease. So if you recognize any of those symptoms, then do have it checked out. And as Dr. Habangana said, there are things that you can do, but important to follow what is prescribed for you.